Understanding depression. Complete and simple guide. Depression is a common but serious mental health condition that affects how a person feels, thinks, and acts. It can lead to various emotional and physical problems and decrease a person's ability to function daily. Everyone experiences sadness from time to time, but depression is much more than just feeling sad. It's a long-lasting condition that interferes with a person's quality of life, relationships, work, and overall well-being. Understanding depression is the first step in learning how to deal with it, support others, and seek help when needed. Depression does not have a single cause. It is a complex condition with many possible contributing factors. One of the most common causes is an imbalance in brain chemicals, particularly neurotransmitters like serotonin, dopamine, and norepinephrine, which help regulate mood. When these chemicals are out of balance, it can lead to sadness, hopelessness, and a loss of interest in life. Genetics can also play a role. If someone has a family history of depression, they may be more likely to experience it themselves. However, not everyone with a family history will develop depression, and many people without a family history do. Life events can also trigger depression. These may include the death of a loved one, divorce, abuse, financial problems, or losing a job. Even positive changes, like moving to a new place or starting a new job, can sometimes bring about stress that leads to depression. Chronic illnesses such as cancer, diabetes, or heart disease may also lead to depression, especially when combined with physical pain or lifestyle changes. Substance abuse, including alcohol and drugs, can both cause and worsen depression. Many people turn to substances as a way to cope with emotional pain, but these often make things worse in the long run. Depression develops over time, and its symptoms can be different from person to person. One person might feel overwhelming sadness and cry all the time, while another may feel numb and unable to express emotions. Some common symptoms include persistent feelings of sadness, emptiness, or hopelessness. A person may lose interest in activities they once enjoyed, have trouble sleeping or sleep too much, and experience changes in appetite or weight. They may feel tired, struggle to concentrate, and have difficulty making decisions. In severe cases, a person might think about death or suicide. It is important to remember that depression is not a sign of weakness or something that a person can snap out of. It is a medical condition that needs treatment and support, just like any other illness. Unfortunately, because depression is invisible, people who suffer from it are sometimes misunderstood. They may be told to cheer up or just be positive, which often makes them feel worse. Recognizing the seriousness of depression and offering understanding is crucial. The good news is that depression is treatable. Many options are available, and most people can find a treatment that helps them feel better. One of the most common treatments is therapy, also called counseling or talk therapy. Speaking with a trained professional can help people understand their thoughts and emotions and learn new coping methods. For example, cognitive behavioral therapy, CBT, allows people to recognize and change negative thinking patterns. Therapy can also help a person work through painful experiences from their past and find healthy ways to move forward. Medication is another standard treatment for depression. Antidepressants work by balancing the chemicals in the brain that affect mood and emotions. There are many different types of antidepressants, and it might take some time to find the one that works best for an individual. It's essential to take medication under the guidance of a doctor and never stop taking it suddenly without medical advice. Sometimes a combination of medication and therapy is the most effective approach. Lifestyle changes can also play a significant role in managing depression. Regular exercise has been shown to improve mood by increasing the levels of endorphins and serotonin in the brain. A healthy, balanced diet can help the body and mind function better. Getting enough sleep is also vital because poor sleep can make depression worse. Creating a daily routine and setting small, achievable goals can help people feel more in control. Spending time with supportive friends or family can also make a big difference. Depression can affect anyone, regardless of age, gender, or background. However, how it appears and is experienced can differ depending on the individual and their stage of life. For example, in children, depression might not always look like sadness. Instead, they might become more irritable, have trouble in school, complain of stomach aches or headaches without a clear cause, or become clingy and fearful. Children might not have the words to describe what they're feeling, so changes in behavior are often the most significant signs for parents or teachers to notice. Teenagers may also experience depression in ways that adults might not recognize right away. Teens are already going through emotional and physical changes, so it can be hard to tell the difference between normal mood swings and something more serious. Signs of depression in teenagers might include withdrawing from friends and family, changes in sleep and appetite, lack of motivation, or a sudden drop in grades. Some teens may express their pain through risky behavior or self-harm. Because teens are still developing emotionally, early intervention is essential to prevent long-term struggles. In adults, depression can look more like persistent sadness, loss of interest in things they used to enjoy, and problems at work or in relationships. Some adults might hide their feelings and pretend everything is fine, especially if they feel ashamed or embarrassed. This can be particularly true for men, who may have been taught to hide emotions or avoid talking about their mental health. Instead of appearing sad, some men with depression may seem angry, irritable, or reckless. Women are statistically more likely to experience depression, and hormonal changes such as those during menstruation, pregnancy, postpartum, and menopause can play a role in triggering or worsening symptoms. Older adults may experience depression differently as well. Sometimes it is mistaken for normal aging, but it is not. Seniors with depression might complain more about physical aches and pains or show less interest in activities. They may also become more isolated, especially when dealing with losing loved ones or facing significant changes like retirement. Depression in older adults is often overlooked, but it is just as serious and deserves attention and treatment. Regardless of age, one of the most painful effects of depression is the feeling of being completely alone. Even when surrounded by others, someone with depression might feel disconnected, as if no one truly understands what they are going through. This sense of isolation can deepen the depression and make it harder to reach out for help. That's why support from friends, family, or mental health professionals is so important. Just having someone to listen without judgment can make a world of difference. There are also alternative or complementary approaches to managing depression. Practices like mindfulness meditation, yoga, and deep breathing exercises can help people become more aware of their thoughts and feelings without becoming overwhelmed. These practices can reduce stress and promote greater calm and emotional balance. Some people find comfort in creative activities like painting, writing, or playing music, which can provide an outlet for expressing hard feelings. Support groups, whether in person or online, can also be valuable. Talking to others who have gone through similar experiences can make a person feel less alone and more understood. People can share advice, encouragement, and stories of hope and recovery in these spaces. While support groups are not a substitute for therapy or medical care, they can be a helpful addition to a person's healing process. In some severe cases where depression does not respond to standard treatments, more advanced options may be considered. These include electroconvulsive therapy, ECT, or transcranial magnetic stimulation, TMS. ECT involves sending small electric currents through the brain under medical supervision to change brain chemistry, and it is typically used only when other treatments have failed. TMS uses magnetic fields to stimulate certain parts of the brain and can be an option for people with treatment-resistant depression. While these treatments might sound intimidating, they are considered safe when performed by professionals and have helped many people who had not found relief in other ways. Understanding that recovery from depression takes time is key. There is no quick fix, and healing usually happens in small steps. Some days will feel better than others, and setbacks can occur. That doesn't mean treatment isn't working, it just means the process is ongoing. Patience with yourself or someone you care about is one of the most loving things you can do. Recovery is possible, and many people who go through depression come out the other side stronger, more empathetic, and more self-aware. Preventing depression entirely isn't always possible, especially when it's caused by genetics or sudden life events. However, many ways exist to reduce the risk and build resilience against its effects. One of the most potent tools is self-awareness, understanding your emotional patterns and recognizing early warning signs. If someone knows they tend to feel down during certain times of the year after a significant life change or when overwhelmed with responsibilities, they can take steps to care for themselves before things spiral. A strong support system also plays a significant role in prevention and recovery. One person who listens, understands, and checks in can make a big difference. This doesn't have to be a therapist. It could be a friend, a partner, a parent, a sibling, or anyone who offers genuine support. Talking openly about mental health should be encouraged, not hidden or shamed. In families or communities where mental illness is seen as taboo, education is key. The more people learn about depression as a medical condition rather than a character flaw, the easier it becomes for others to seek help. Establishing a healthy lifestyle can be an essential buffer against depression. While no routine can guarantee perfect mental health, regular sleep, nutritious food, movement, and moments of relaxation all support the body and mind in meaningful ways. Exercise, in particular, is known to have antidepressant effects because it releases feel-good chemicals like endorphins and can improve self-esteem and energy levels. A good night's sleep can reset both the body and emotions, but depression can make sleep tricky. Having a regular bedtime, avoiding screens late at night, and keeping the bedroom comfortable and calm is often helpful. Maintaining a sense of purpose can also help people stay grounded. This doesn't have to mean having a high-powered career or constantly being busy. A purpose can be simple: taking care of a pet, helping a neighbor, learning a new hobby, or setting small personal goals. When someone feels like they matter or contribute somehow, it can reduce feelings of emptiness or worthlessness. Volunteering or helping others in need can also give a surprising boost to your mood. Sometimes it's helpful to track emotions and patterns. Journaling or using a mood tracker app can show how your mental state changes over time. This information can be beneficial in therapy or just for personal reflection. When you see your ups and downs written out, it's easier to understand what's going on and to notice any improvements or triggers. People often feel stuck in the moment, but looking back at progress, even small wins, can be very motivating. One of the hardest things about supporting someone with depression is not knowing what to say. You might feel helpless or afraid of saying the wrong thing, but simply being present and listening without judgment is often enough. You don't have to fix them. Just showing up and letting them know they're not alone can mean everything. Avoid telling them to cheer up or just think positive, as this can feel dismissive. Instead, try saying things like, "I'm here for you," or "It's okay to feel this way, let's get through it together." Encouraging a loved one to seek help is essential, but it must be done gently. If someone resists therapy or medication, try understanding their fears or concerns. Offer to help them find a therapist or attend an appointment if they're nervous. It's also essential to care for your mental health if you're supporting someone else. You can't pour from an empty cup, and burnout is real, especially when you're constantly trying to lift someone else. Support groups for friends and family members of people with depression can be a great source of comfort. Sometimes people with depression may have thoughts of harming themselves or not wanting to live. This is very serious and requires immediate help. If you believe someone is in danger, do not leave them alone. Please encourage them to call a mental health hotline or go to the nearest hospital. In many countries, there are free and confidential services available 24/7. Even if you're unsure what to say, being honest and expressing concern can save a life. Asking someone directly if they're thinking about suicide does not put the idea in their head, it shows you care. Spirituality or belief systems can provide hope and comfort for many people. Whether through religion, meditation, or a sense of connection with nature or the universe, these practices can help people feel grounded and less alone. However, this isn't true for everyone, and it's okay if someone finds meaning in other places. What matters most is having something that brings peace or perspective during hard times. recovery from depression is often not a straight path. Some people feel better quickly after starting treatment, while for others it may take weeks or even months to notice a real change. It's essential to be patient and kind to yourself during this process. Healing is not about flipping a switch, it's about slowly rebuilding emotional strength, gaining new coping skills, and learning to manage symptoms when they arise. There may be days when you feel like you're moving backward, but this is a regular part of the journey and doesn't mean you've failed. A critical part of long-term recovery is understanding what triggers your depression and developing a plan for how to deal with those triggers. Triggers can be anything from stress at work, unresolved past trauma, loneliness, or even changes in seasons. Once you know what affects you most, you can make better choices to protect your mental health. This could include setting healthy boundaries with others, avoiding toxic environments, or making time for activities that bring you peace and joy. Creating what some therapists call a toolbox of strategies to turn to when you're feeling low is also helpful. This might include calling friends, walking outside, writing in a journal, practicing mindfulness, or listening to calming music. Over time, these small actions can become habits that help keep depression from taking over again. Not every strategy will work for every person, so it's okay to experiment until you find what helps you most. Another part of long-term wellness is continuing therapy, even after you start to feel better. Some people stop going to treatment as soon as their symptoms improve, but this can lead to relapse. Therapy is not just about getting through a crisis, it's also about learning how to maintain stability and prepare for future challenges. Think of it like going to the gym for your mind. Regular sessions help you stay mentally strong. Sometimes depression exists alongside other mental health conditions. This is called a co-occurring or comorbid disorder. Anxiety is one of the most common conditions that occurs with depression. Many people with depression also experience constant worry, racing thoughts, or panic attacks. Two conditions can feed into each other, making both more challenging to manage if not treated together. Treating only one may not be enough, so a complete mental health assessment is essential. Other conditions that may appear with depression include bipolar disorder, post-traumatic stress disorder, PTSD, obsessive-compulsive disorder, OCD, and various personality disorders. Each of these has its challenges and may change how depression is experienced. For example, someone with bipolar disorder may swing between periods of deep depression and episodes of high energy or impulsivity. Someone with PTSD may feel numb, on edge, or haunted by painful memories, which can deepen their depression. Understanding the whole picture helps professionals choose the right treatment approach. In some cases, depression is also linked to physical health conditions such as chronic pain, thyroid disorders, or neurological issues. These health issues can make depression harder to treat, which is why communication between your mental health provider and your general doctor is so important. Managing your physical health, staying updated on checkups, and being open about emotional and physical symptoms helps create a more complete treatment plan. Medication may need to be adjusted as your body and brain change. Some people need to stay on antidepressants long-term, while others may be able to taper off with medical guidance after their symptoms are under control. It's crucial never to stop taking medication suddenly without consulting a doctor, as this can cause withdrawal symptoms or a return of depression. If a medication stops working or causes side effects, many alternatives exist, and your doctor can help you find the best fit. Maintaining mental health after recovering from depression means checking in with yourself regularly. This might mean asking, "How am I feeling? Am I making time for rest and connection? Am I ignoring stress signs or bottling up emotions?" Making mental wellness a part of everyday life, rather than just something to focus on when things go wrong, can help prevent future depressive episodes. Building this awareness can take time, but it's a powerful way to stay ahead of the condition. It also helps to stay connected with others. Isolation is both a symptom and a cause of depression, and human connection is a key part of emotional healing. These connections remind us that we're not alone in our struggles, whether it's close friendships, family ties, romantic relationships, or community involvement. People who maintain strong social bonds often recover faster and stay healthier emotionally. Depression can feel like a heavy fog that never lifts, but it's important to know that there is always hope. Many people who go through depression eventually find their way to better days, even if it takes time. Recovery doesn't always mean the depression disappears forever. It often means learning how to manage it, understanding your triggers, building a support system, and having tools that help when dark days return. Just like someone with diabetes learns to manage their blood sugar, someone with depression learns to manage their emotional well-being. One of the most powerful things you can do, whether you're going through depression or supporting someone who is to remember that you are not alone. Millions of people experience depression every year. Many have shared their stories, written books, created art, spoken publicly, or quietly supported each other in countless ways. Knowing that others have felt the same pain and made it through can be incredibly comforting. Even reading this guide is a step toward healing because learning, acknowledging, and reflecting are signs of inner strength. When someone you care about is depressed, it can be hard to know what to do. The most important thing is to show up and be present. Depression often lies to people, telling them they're a burden or that no one would understand. Sitting with them, sending a message, or inviting them out, even if they say no, can gently remind them that they matter. You don't need the perfect words. Your compassion and presence are enough. Avoid advising unless asked. Instead, focus on listening without judgment. Say things like, "That sounds hard. I'm here for you," or "I don't know exactly how you feel, but I care and want to help." Don't pressure them to snap out of it or look on the bright side. These phrases, though well-meaning, often make people feel more alone. Depression isn't about weakness, it's about a brain imbalance, life circumstances, or both, and it can't be solved by willpower alone. Sometimes people don't talk about their depression. They may laugh in public, keep up appearances, and struggle silently. Regularly checking in on your friends and loved ones is essential. Ask them how they're doing, not just in passing. Creating a space where people feel safe to share is one of the most valuable things we can offer each other. And if someone opens up to you, honor that trust. Don't minimize what they're feeling or rush to fix it. Just be there. Society also has a role to play in how we treat mental health. There's still a stigma attached to depression in many places. Some people fear seeking help because they think it means they're broken or weak. But the truth is, asking for help is one of the bravest things a person can do. The more we talk openly about depression, the more we normalize it, and the more people will feel safe reaching out. Schools, workplaces, religious communities, and governments all need to treat mental health with the same seriousness as physical health. This includes better access to affordable therapy, school mental health education, workplace policies that support emotional wellness, and public awareness campaigns that challenge harmful stereotypes. If we start treating emotional pain with the same urgency and compassion as physical illness, we will save lives and improve them. Technology can also be a helpful part of support. Mental health apps, online therapy, and support forums have made it easier for people to find help when and where they need it. These tools can offer a lifeline, especially in remote areas or during difficult times like the pandemic. Still, ensuring these tools are used as part of a larger recovery plan, not as a replacement for real-life support and care when needed, is essential. In closing, if you're someone dealing with depression right now, please hold on. There is no shame in struggling, and there is help for you. You are not broken. You are not alone. You are not weak. Healing is possible even if you can't see it yet. The world is better with you in it. And if you're someone supporting a loved one, thank you. Your patience, presence, and love could be what carries them through. Keep reaching out. Keep showing up. You are making a difference. Let's build a world where talking about depression is as normal as talking about a cold, where help is easy to find, and where no one feels ashamed to say, "I need support." 'Cause everyone, no matter what they're going through, deserves compassion, understanding, and hope. That's it for now. Please let us know in the comments what you learned from this video. Thanks for your time. See you later.